Hello all, I'm Dr. Santoshi Nagaonkar, Director of Department of Urology, Urological Cancer Surgery and Robotic Surgery. In continuation with our series of conversation with various specialists involved in treating prostate cancer, and this is with the background of upcoming November, which is the month of men's health promotional events. So we are discussing about prostate cancer, which is one of the commonest diseases which we encounter nowadays. And we have already discussed about some medical oncology therapy for prostate cancer. And today I have Dr. Karuna Luthra. She is the head of our nuclear medicine department at Sir H.N. Reliance Foundation Hospital. And we are going to discuss with her some basics about nuclear medicine and how it is helpful in diagnosing and treating prostate cancer. I welcome Dr. Karuna. Thank you for being here, Karuna.
Thank you for having me, and hello everyone.
So my first question to you for our audience is, what do you mean by nuclear medicine? Because many people, they don't know what is this nuclear medicine study and how it is different than a CT scan or an MRI.
Okay, so in nuclear medicine, we use small amounts of radioisotopes to diagnose various diseases, cancer and cancer prostate being just one of them. Instead of the radiation being, exposed on the body from outside as we do on a CT scan, in nuclear medicine, we actually inject labeled radio tracers into the body, which give us functional information about different organs in our body. And these are then imaged using cameras known as the PET CT scanners, which you may have heard of, or the gamma cameras. So while radiology gives us structural information, with nuclear medicine scans, PET CT, we can actually understand the function of organs, and it is one of the most sensitive methods of diagnosing cancer anywhere in the body.
Excellent. That's great. So any cancer, as we know, has other cancer cells. They are metabolically active. They have got high rate of breaking down into different cells, what we call mutation. And when this activity is happening, they create a lot of energy, and this energy has to be picked up. And that's how the nuclear medicine helps us in evaluating the progression of cancer as well as in diagnosing prostate cancer. So my next question to you is going to be, how does nuclear medicine helps, or the PET scan helps in diagnosing prostate cancer?
Okay, so while for all other cancers in the body, we use a tracer known as FDG because they use a lot of glucose. Prostate cancer is very different, and for many years we didn't have a proper imaging tool for detecting the spread of prostate cancer. However, now with the discovery of PSMA, which is prostate-specific membrane antigen, we have a very specific target which is overexpressed on prostate cancer cells. So using this target, we can actually image these tumors right from the initial stage when the cancer starts developing in the prostate gland, when you are suspecting, right from that stage to the advanced stage when the disease has spread to lymph nodes, to bones, to other parts of the body. So what we do is called the PSMA PET CT. It is a very specific PET CT only for prostate cancer, and it helps us in staging the disease, evaluating response to therapy, and of course we know that the PSMA target is utilized for us in treating these tumors also.
Correct. Excellent. So that's the beauty of the PSMA PET scan, because about 15-20 years ago, we used to do many tests to evaluate the staging of prostate cancer. But now we know that PSMA PET scan is actually, the synonym is one-stop shop. You just do one scan and you will know what is the staging of the disease. So that's why I think this has evolved in diagnosing prostate cancer. So my next question is going to be, nowadays we have also realized that these nuclear tests or nuclear dyes, they can be used to treat prostate cancer. How does that work?
We have different types of radioisotopes. When we want to scan for cancer, just to look at it, we use a very short-lived isotope, which we can see on the PET scanner. But we also have very powerful radionuclides, which are the beta and the alpha particles. Now, these deliver targeted radiation to tumors. Okay. Now, how do we reach this beta and alpha radiation to tumors which have spread in the body? We use this target molecule that is called PSMA. We tag the beta and the alpha particles to PSMA, which then acts as a carrier, carrying it to different parts in the body and delivering very targeted radiation. So we know that for many years, radiation has been a very effective tool in treating cancers. However, when we give external radiation, it can be used only when the tumor is localized within the prostate, or it is oligometastatic disease having spread to maybe just 2 or 3 areas. But in advanced disease which has spread to multiple areas in the body, we have this very powerful molecule called PSMA, or the prostate specific membrane antigen, using which we tag our alpha and beta radiation and we deliver treatment using radiation to these tumors.
Okay, excellent. And is it available at our HN hospital, the PSMA lutetium
Yes.
Therapy?
Yes. So the beta radiation which I was talking about, that is the lutetium-177 PSMA therapy, is routinely done at our hospital, as you would be aware, and we have treated a good number of patients very successfully, because after hormonal therapy fails, there are actually very limited options which were earlier available to rein in the disease which would have spread. But now with the availability of lutetium targeted PSMA therapy, we are able to sustain these patients and at the same time maintain a good quality of life for these patients for prostate disease.
Excellent. So that's the bottom line. We at Sir H.N. Reliance Foundation Hospital, we have got a comprehensive cancer care unit and we have got everything under the roof. So once again, I reiterate, it is a one-stop shop here as well at H.N. Hospital, where we can offer robotic surgery, we can offer precision oncology, chemotherapy, and even advanced therapies like radiotherapy like ethos or lutetium therapy for prostate cancer. And we are more than happy to help you out if you have any questions. And we'll continue our series of conversation with various specialists involved in treating prostate cancer. So I thank you, Dr. Karuna, for being here and giving your valuable time. Thank you.
Thank you.